Hi, everyone, and welcome. Like Beth said, my name is Jean Pulvermacher, and I'm the co-director of the Great Lakes Addiction Technology Transfer Center. We are located at UW-Madison in the Center for Health Enhancement System Studies, and we are funded by SAMHSA to help people and organizations implement effective practices for substance use disorder treatment and recovery services. We serve Region 5, and that includes the states of Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. I'm really happy to be here with you all today, and I'm very happy that we are on the third of our three-part webinar series for PPW. I just want to say thanks to AHP, their whole team, and to Deb Werner for helping to put this all together. And with that, I will hand it off to Deb. Thank you.
Great. Thank you so much, Jean, both for handing it over for this particular webinar, but I also want to thank you and the Great Lakes ATTC for your leadership around addressing the needs of pregnant and parenting women with substance use disorders and looking for innovative strategies, family-centered approaches, really have that focus on recovery supports. You all are just doing excellent work throughout the country with this webinar series and with many, many other things. So as Jean said, this is the third of a three-part series on special considerations in working with pregnant and parenting women with substance use disorders. And following this, we will have a learning collaborative for leaders that I'll tell you a little bit more about at the very end of the webinar. The first two webinars, the first one focused on marijuana and special considerations to pay attention related to marijuana when you're serving pregnant and parenting women or people. And then the second one was really an update around fetal alcohol spectrum disorders across the lifespan and some of the considerations there. And then today we are focusing on a specific population, and that is pregnant and parenting teens and young adults with substance use disorders. So I'm really glad to be here and to get to spend an hour and a half with you all today talking about this really important topic. And I'm going to invite everybody to put into the chat box why this topic is important to you. So if you could take a moment and just sort of say why you're here today. What is it about this particular topic that you think is so important to address? And you can also add any questions that you already have kind of coming up for you as you're thinking about how you provide services specifically for pregnant and parenting teens in the text box. I'm going to say that this topic is really important to me because oftentimes we forget to pay attention to the specialized needs of young people when pregnant and parenting teens and young adults who are coming into our programs. So there's this expectation that they act and think and be and need really the same things as older adults that we're seeing come into our programs. And then it doesn't work out and they're not able to deliver it, or they don't engage with the service system. And then they go off and kind of do their own thing, or they end up losing custody of their children, and it doesn't work. So for me, this is really an important topic because I have seen so many successful families with a teen who is developing, who is also parenting and supported in that role, as well as their lives in recovery. And I've also watched really some of, I would say, the most hardworking, successful young people who really started off with the look of, we're doomed, we're seen as the failures and like we can't do anything right, and really end up, when you take a look and get to know how many things they have on their plate and they're doing really well with. So I've seen that with those supports so much as possible. So I'm really glad to be here with you all talking about this topic. I also am going to introduce our two speakers for today. We have Euna Ross-Smith. She's the Senior Program Manager for the Your California Youth Opioid Response Program, and a licensed clinical social worker who's been working with this population for about 20 years. And I'm going to go ahead and introduce Veronica, and then I'm going to invite each of you to talk about why this topic is important to you. So that's Euna. And then we also have Veronica Welch, who is a program associate working on our crisis response and justice interventions programs at Advocates for Human Potential. She is based in Fresno, California, and has also spent a lot of her career working with foster family agencies and young adults whose children are in the foster care system, who are trying to get their children back. So they both bring a wealth of experience and knowledge into the topic. And with that, let me just invite each of you to share why this topic is important to you. Euna, do you want to go first?
Sure. Thank you so much. And it's so exciting to be here. And as Deb said, my experience working with pregnant and parenting teens has been mostly with young girls who have been in foster care or juvenile justice, so in group homes, in transitional shelters, or with the older TAY population who are at risk of homelessness. So I think it's this twofold thing where the resiliency and the strength of these young women who are sometimes alone, who are sometimes been, system involved for a very long time, of them being able to rise above and really want so much more and so much better for their children and really working for that. And I've really enjoyed the work with them. And to be honest, just programmatically having babies in the program, it's fun. Our staff loved it. We would, there's babysitters on hand. We loved it. There's just something else that comes from that, the joy of seeing that. But then on the other hand, we were always at this dual client, right? So you are always making sure you have this young person who, has had substance use and trauma and other mental health concerns and issues going on. Now they're pregnant and or they have children, right? Multiple pregnancies or multiple births. And both of them, you're trying to make sure the needs of both the child and the young adult or the young teen mom are being met. So it was definitely this dual process and really looking at prevention, right? Making sure, right, this cyclical cycle, generational cycles do not continue. So making sure services are in place for this young teen mom and also for the child. So definitely it's so full, and it was so fun and challenging. So that was my experience with it.
Thank you, Euna. Oh, Deb, you're muted.
I was just saying thank you and Veronica, so go ahead.
All right. Well, thank you, Deb. Hello, everybody. My name is Veronica Welch. I'm very excited to be here. The topic of retaining and working with parenting pregnant teens, it's kind of twofold for me. I have a personal passion about it because I was a young mother in my early 20s, had a baby as a single parent, and I was blessed to have a very strong home base and great family to support me. But then, moving into my professional life and working with young adults, teens, women who did not have the privileges that I had, there's such a great need for everybody out there to be educated and have an understanding of what the needs are for this population. And I think that the work that we all do really helps to break, cycles of generational trauma and just really help young people thrive as they are navigating motherhood, parenthood. So that is it. Thank you so much.
Great, thank you. I'm looking very forward to your presentations today. So the agenda that we have scheduled with you all is really 4 kind of key areas. We have the welcome and introductions. And we're going to spend some time talking about who is it that we're talking about? What are some of the information that you really need to know about pregnant and parenting teens, and then a good chunk of the time really on what they need, what those needs are, and then we'll do some wrap up and key takeaways. So that's what we have for our agenda scheduled for today. So this first section really talks about who they are, understanding pregnant and parenting teens and young adults. And we have 4 different topics that we're really going to touch on. And again, just kind of that reminder that some of the experiences may be similar to the adults that you're finding in your program, but some of them really are unique and different for particularly adolescent and young adult parents. So we're going to speak a little bit more specifically about 4 topic areas: the stages of development, risk factors, and I think Euna's going to talk about those too, and then and teen dating violence, and then Veronica is going to come in and talk a little bit about LGBTQIA plus and how that factors in with pregnant and parenting teens and young adults. So with that, let me go ahead and turn it over to Euna for the stages of development.
Perfect. Thank you. We love this picture, right? The color and the beauty and just the pow. So sorry. Every time we saw this, we're like, we love this slide. So the Erikson stages of psychosocial development, we're just going to do a quick overview of it, just as a more of a grounding piece of remembering, who the teens are, where they're at. So again, you have, 16, 18, 19-year-old teenage girl who is pregnant, who might have children. They're really at the stage of identity and confusion. They're trying to figure out who they are and how do they belong in this world. They're looking to be in relationships, right? And figuring out how to, enter into more of an intimate relationship. There's a lot of stuff happening for them, right? Trying to self-identity, figuring out who you are, your place in the world. On top of that, right, all the trauma, we're going to talk a lot about their at risk and what makes them high risk. There's substance use in there as well. So you're battling that of understanding who you are, and then you're bringing in, a child into this world. So also trying to figure out where their babies and their young children fit in this psychosocial development. So definitely, as you hear, it's definitely this twofold task that they're definitely being challenged with. And we also know that this isn't, rigid. This is kind of a fluid psychosocial development chart where, different levels of trauma and different areas where you've experienced trauma, you might have some start and stops and, back and forward. So just to kind of remember that this is where we're at and what our young people are dealing with right now. Okay. So we're going to talk about risk factors. So we know that parent and pregnancy adolescents are at higher risk. Socially, marginalized populations have an additional risk, and then also with mental health issues and behavioral health concerns. So social risk, we know that there's a high level of school dropout. So it's hard, right? Unless they're, I've worked with young girls who their schools do not offer childcare. So then they have to get up, drop their kids off somewhere else, or have somebody drop their kids off at another center or whatnot. So it's hard to go to school. And then also the truth is the stigma behind, pregnant teens, that, their peers might be talking about going to football games and, going out for, pizza after school. And yet they are tasked with, trying to, go to their prenatal appointments and figure out how to do homework and, didn't sleep the night before because their, infant was up. So definitely school dropouts are high. Lower educational and vocational attainment, definitely not going up to higher levels of education and also with work. Repeat pregnancies, and you'll kind of see that threaded throughout as our talk today, because that is definitely a huge risk factor as well. A lot of these young folks have experienced a lot of violence, whether it's in their own communities, whether it's to their own selves by, parents or partners, or, just witnessing violence, living in poverty and chaotic households. They might need government assistance. And then at the end of the day, as we talked about prevention, we know that the risk factors increase for the children of these adolescent mothers. Again, you're looking for the children and these infants as well. We know for marginalized populations that there's a higher rate of birth among Black and Hispanic adolescents. We know that there could be, again, higher adolescent birth rates for those who come from families with lower education or income levels. Adolescents in foster care are at higher risk of becoming pregnant, and lesbian, gay, bisexual youth are more likely to become pregnant or to impregnate someone else. So these are kind of the social factors that we are the risk factors that we are looking at. Behavioral health wise, we know that the three diagnoses that tend to come up for this population, the highest is depression, substance use, and PTSD. So when we look at depression, we know that adolescent mothers are going to experience a higher rate of prenatal, so before and postpartum depression. So the rates are 16 to 44% compared to 5 to 20%. So 2 to 3 times higher risk for adolescent mothers with depression than non. And it's not just during adolescence that that these young folks will have a higher level of depression. One study found that 20 years after the birth of the first child during adolescence, that a study of African-American adult women found that there's a 2-fold increase in depression. So even 20 years after that. So again, these are things that you're looking for, again, and not just in that moment. And then adolescent mothers might be at higher risk of suicidal ideation. Now, the suicide risk for this population isn't that high. It's not a huge major red flag concern. However, the rates are about up to 11 to 30%, and it's about 19% for those who are not mothers. So just, again, things to be aware of and watching out for. When we look at substance use, there is a higher percentage of use reported among pregnant adolescents compared to the non-pregnant. They found that substance use tends to decrease during pregnancy, but statistics are a little bit off because there's a lot of underreporting. So it runs anywhere from 11 to 52%. And that's because sometimes, you know, the young person will say, no, there's been no use, but during the study that there's a urine test, a drug test, and it comes out positive for some type of substance. So that's why the numbers are very vary. But overall, studies are finding that the substance use during pregnancy, it declines, but it's that 6 months postpartum that through adulthood that it tends to increase. And again, I think that's a huge key takeaway. It's postpartum. And I mean, you hear this, you know, I'm a mom and, you know, folks show up for you when you're pregnant, but once you have the baby is when you may not have as much support, and that's when it's needed. So knowing that you have, you know, a young person who might be dealing with substance use and has been doing great, right, has been doing great during their pregnancy, you want to make sure you have a very strong, clear plan and like a plan of approach postpartum, because that's when the risk starts going up again. All right, and then trauma. So we know teen moms are at higher risk of developing PTSD. They're coming from communities and, you know, personal lives where there is more violence and exposure to violence. One study found that for teen moms, they've experienced more than 5 traumatic events. And this could be physical attacks by a partner, neglect, abuse by a parent, incarceration, and traumatic loss. So that is about 50% of these adolescents who are parents are meeting criteria for PTSD. So that's really significant, and definitely an area where you can figure out what to do, where to go, how to help. And these adolescent mothers, compared to adult mothers, are 2 to 3 times more likely to be victimized by a partner, father of the child, or family member. So screening, super, super important, right? And it's not just, it's screening for all, because you don't know, and you don't know, you know, what this young person is experiencing. So making sure that abuse, domestic violence, safety is you're screening for that. Mental health disorders. What kind of family and social supports are there available? Like real social supports available for this young person. And then what is their access to physical and mental health care? You know, you're going to be seeing them in, you know, through your school centers, clinics, whatnot. And the assessment needs to be happening for them all, so that you can start catching these, because again, it's a high risk factors that you're being presented with. Making sure there's a list of screening tools, assessment and screening tools. I'm sure you're familiar with a lot of them and are using them. So just making sure that, you know, we're being really diligent about screening and assessing our young folks who are coming in to see us. All right. And then with that, we're going to talk a little bit about teen dating violence. I know it's a lot of heaviness here, and we'll get to the empowerment and resilience in a bit here. But for teen dating violence could be physical, it could be psychological, emotional, sexual, stalking. And so it's the 1 in 5. So 1 in 5 teen girls who are coming through to see you in your clinics, at your schools, at your mental health sites, have experienced physical or sexual violence in an intimate relationship. That's about 400,000 adolescents in the United States per year. And the highest rate ages-wise is 16 to 24. So just kind of keeping that in mind. again, adolescent mothers can experience, dating violence at any point, right? And we have that they are, so during and after pregnancy, they're 2 to 3 times more likely to experience violence than like pregnant women are. And then we also know that when we talked about the repeat pregnancies, that mothers who experienced physical abuse within 3 months after delivery were twice as likely to have those repeat pregnancies. So again, when we talk about that postpartum, we talk about making sure that there is a plan. Safety is for sure something to be assessing out. So the risk factors, how do you know someone might be in this teen dating violence is, again, extreme jealousy, insecurity, the possessiveness, the partner needing to know where this person is at all times. I even had young girls who had to take pictures of, like, in being in residential care, taking pictures to show where they physically are at, and had to tell their partner everything, even though they're in residential care. And then adolescent females using the teen clinics, school health centers, reproductive health clinics. This is an entry point for them. This is where access comes in. They are reporting higher rates of physical and sexual victimization in their dating relationships. So that's definitely something to key into if that's the field you're in, so that you can definitely assess for that. But that is a definite entry point. And again, those who've had physical sexual abuse, who've been in more chaotic homes where they've violence or lower socioeconomic status, are at higher risk. And the risks are depression, right? Antisocial behavior, PTSD, suicide ideation, high-risk sexual behavior, substance use, and unintended pregnancy. So what do we do, right? So how do we respond to this? We provide universal education on healthy relationships, and not only to the women, boys as well. I worked in a correctional facility, and I did teen dating violence with young men. And at first I was like, okay, you're pulling my leg. You got to know that what you're doing is not healthy. It's not safe. But I really believe that they didn't know. And they were kind of surprised when I said, you do not get the right to know where your significant other is at all times during the day. And it was a little bit of something that they've never heard before. So making sure universal education, what is healthy relationships, is for everyone. You offer patient support, validation, harm reduction strategies. I think somebody mentioned in the chat about harm reduction strategies. Of course, it's not that easy, right? It's not that easy. There's definitely cycles. There's definitely, relapse in all of this. So making sure that you're looking at harm reduction. And again, assessment, so important. You assess for coercion. Is there reproductive coercion going on? Is there forced sex? Is there birth control sabotage? Is there pregnancy pressures, condom manipulation? You also want to assess for substance abuse. Like, is there forced substance use? Are they controlling through substances? Are there threats if they don't use? So definitely making sure that these questions, and look, not as comfortable, but be comfortable with them. Ask yourself these questions, practice them, make sure you're asking these things. We suspend judgment, and we always use a trauma-informed approach for everything, everybody, right? Not just this population, but always. And then remember that this is sensitive information. You want to do this in a private and safe setting. I remember when I was pregnant, and they put me in a room with my husband, and they gave me a little laptop thing, and I had to mark if I'm being, if I'm in a unsafe relationship. And I'm sitting here going, my husband is sitting right next to me. Let's say he was. How comfortable would I feel marking these boxes with him right there? So when you're doing it, making sure that it's in a private and safe setting. All right, and I'm going to turn it over to Veronica for this.
Thank you, Euna. So much great information. So I'm going to start with talking about working with the LGBTQIA+ youth population. So this is just some general information about the LGBTQ+ youth population in the United States. There are an estimated 2.7 million adolescents who identify within the LGBTQ community. And I'm going to go out on a limb and say that number is probably a lot higher. But there are, I'm sure, a large number of youth who do not disclose that they are LGBTQ. But that's just you just get an idea of how many youth identify within that community in this country. With that population, they face a myriad of harmful risk factors to their livelihood. A lot of them experience harassment, various forms of abuse that include physical abuse, verbal abuse, emotional abuse, homelessness, because they do identify as LGBTQ, they're kicked out of their residence. Their parents don't want them to live with them anymore. And that can lead to substance use disorder, dropping out of school. So there's just a very high number of risk factors for this population. And, these adverse experiences often lead to LGBTQ youth experiencing social isolation, mental health issues, depression, anxiety, suicidal ideation. So this population is just at such a greater risk of substance use and experiencing challenges in their life. So what are those challenges? Let's talk a little bit more about what those challenges are that they experience. The first one is discrimination and stigma from society. So even though we're moving towards being a very progressive and compassionate towards the LGBTQ community, there's still discrimination. They're still experiencing discrimination, and there is still a stigma attached to identifying within that community. And the youth can definitely feel that. They'll feel that, in their homes with their families, at school, in social groups, and just, being out in the community. They're going to experience discrimination, and they're going to be judged, and there's going to be a stigma attached to them. Also, with this population, there is a limited availability of programs and healthcare services tailored to their needs. So it's very important, I think, for all of us to work with healthcare providers, mental health professionals who are going to tailor to the needs of our life and our lifestyle. And it's very limited for LGBTQ youth that they have programs and healthcare that are really specific to their needs. And the third one, like I mentioned a few seconds ago, they often will refrain from disclosing their identities in fear that coming out will result in abandonment by relatives and social groups. And that refraining from disclosing their identities can often lead to them not seeking supports and not receiving therapeutic services that are needed in order for them to process their trauma and refrain from abusing substances. With the next one, with LGBTQIA+ youth who are also a person of color, they're experiencing a double stigmatization. So they have a specific sexual orientation or gender identity, and then they're also a person of color, and both of those carry a great deal of stigma in society and discrimination. And so imagine being both and carrying being judged and experiencing discrimination because you are a person who identifies as both. So that can be a very, very heavy load for LGBTQ people of color youth to carry. The next one is something that I feel like is not talked about that much, and that is identifying as a particular gender yet experiencing medical issues related to their biological gender. So if we're working with an LGBTQ youth who identifies as male and lives their life as a male, but biologically they are a female. So they still have breasts. They still experience a menstrual cycle. They're still going through all of the things that females experience in their teens, in that youth age. And so it can be very, very, very hard for them to to go through those changes and to go through those biological, physiological changes with their biological gender, but they identify as the other gender. So that's just something that it's not talked about a lot, and I don't think it's something that necessarily would, we would, anybody working with LGBTQ youth or somebody who is transgender, we wouldn't necessarily, that's not the first challenge that would pop into our head, but that can be extremely stressful for a youth, especially they're in that phase where they're still trying to just figure out their identity just as a human being, like what foods they like, what kind of music they like, how they like to dress, and then they identify as trans, and then they're experiencing medical issues related to their birth gender. And the last one, identifying as male and non-binary while pregnant. So that's another one that I feel like is not discussed very often with this community, and particularly with youth. And like I said, youth are going through that phase where they're trying to figure out themselves, and but they're still teenagers, and so they're still going to experiment. They may engage in sexual activity, and they may become pregnant, because biologically, if they're a woman, they can become pregnant, but they're identifying as a male. And so that's also another really heavy load to carry, and that comes with another set of needs that healthcare providers need to be aware of when working with this population. All right, so how can we support pregnant and parenting LGBTQIA+ teens? The first one would be to actively participate in continuing education. So making sure that you're attending webinars, you're reading books, you're reading research studies, case studies on this particular population, just so that you have knowledge on what they're experiencing and what challenges that they are going through. Next one would be to assess. So we want to make sure in our practices that we are asking the right questions, using the correct assessment tools to work with this particular population. We want to make sure that they understand that their needs are going to be met through the proper means of assessment. And when we're doing a proper assessment and we understand what the needs are of this population, then we can treat them with the appropriate treatment services that are going to help them. The next one is going to be to be flexible. So there's going to be a myriad of different needs that are going to be out of the norm for a pregnant person when you're working with LGBTQIA+ teens. So there could be transportation issues, there could be issues of confidentiality, them not wanting to know that, not wanting to know that they're wanting their family to know that they identify within this community. They may be hesitant to want to come into your healthcare facility in fear of somebody seeing them and finding out that they're pregnant or finding out that they're LGBTQ. So we just want to be flexible and keep an open mind when working with this particular community, and be understanding that we may have to do things that are out of our normal mode of practice to serve this population. And that could even be doing home visits, going into the home because they don't have transportation, or they don't want, like I said, they don't want to come into your office. That can be, doing telehealth appointments because because that's what they're more comfortable, how they're more comfortable communicating with you. And we'll talk about that in a second, but keep an open mind and be flexible. That is key with this population. The next one would be educate. So make sure that your staff, people that you work with, your cohort, your community, your coworkers, make sure that they are educated on what this population needs. In putting this presentation together, we really found that there was not a lot of information out there, excuse me, about how to support pregnant and parenting LGBTQIA plus teenagers. It's not discussed a lot, and I don't think a lot of research and work has been done with this population to explore their needs. So it's really important that if you're going to serve this population, you do the research, find out what is out there so that your staff and your community are educated on the best practices of how to work with this population. And the last one would be to monitor and assess. So you're going to want to monitor the practices that you are utilizing in your practice on how you're working with this population. And you're going to want to assess the best practices that you're using, and making, just to make sure that they're successful and that the population that you're working with is receiving the treatment that they need. And that can be anywhere from pre and post, treatment surveys, follow-up visits, follow-up calls, just making sure that the services you're providing are working for the particular population are key. And if they're not, assessing how they can be modified so that they are going to be useful for this population. All right, so now we'll turn it back to Deb to open up the floor for another question.
Yeah, great. Thank you so much, Veronica and Euna, for that robust conversation, kind of who it is that we're talking about. And, so I am going to invite you in a moment to respond to this question in the box, but just to kind of recap parts of what we were talking about in that who. One of the reasons why we talk so much about LGBTQIA young people is because we always want to be careful of our assumptions. So when you have a pregnant teen or young adult coming into your program, you don't want to make the assumption that they are heterosexual. You don't want to make the assumption that they are cisgender female. Because especially among young people, we're seeing a lot of gender fluidity. So being careful of that assumption, just like the assumptions around trauma, we say, assume to include, be inclusive. So assume that there's trauma somewhere and then work with it that way. So the same thing is true. You want to have that level of openness to make sure that you are not excluding or making somebody feel other than as you're building your program. So some of the other factors that we've talked about in this kind of who people are includes paying attention to their developmental stage. They're not just the same as other people, but they're still in some process in learning. This is the time where depression and PTSD and anxiety rates increase a lot within the teenage years. So being mindful of potential for co-occurring disorders, being mindful of that potential for discrimination. Dating violence does look a little bit different for teens than it does for adults. Oftentimes you're going to be seeing teens who are pregnant, who the person who has led to them being pregnant or their primary relationship is actually somebody who's much older than them. So being really mindful of coercion and what those risks are. And we know also with all of these things that if they don't feel safe, they're not going to talk to you about these things, right? So oftentimes for a young person who is experiencing intimate partner violence, it's also their first primary relationship, and they're seeing these people and working with these people, and they don't necessarily want to share it with their parents or with you, or even know how to judge that this is not a healthy relationship. So making sure that they feel safe and that they're building in that kind of education. And then, of course, with their brains and their hormones surging, so the mood swings that are natural, you add pregnancy to that, and you have even more of some of that that's also just happening because of the nature of where they are. Their brains, their prefrontal lobes still developing and thinking through some of the pieces that Euna talked about at the beginning around building their sense of identity. And this is who I am. This is part of my friend group. And so building in some of that flexibility that Veronica's really talked about. So those are those factors. And I'm sure that I didn't hit all of them that Euna and Veronica have really talked about. And I want you to go ahead and put into the chat box, when you're working with pregnant and parenting teens with substance use disorders, what are those factors that come to the top of your mind for you? What are some of those first things that make that your awareness is sort of sensitive to, or that you think are really important to make sure that you're addressing? So go ahead and put some of that content into the chat box for us. And with that, I think as we're doing that, I'm also going to have us go ahead and start to move forward into the next section around what their needs are. And we saw some of this also coming up in some of your chat messages earlier in terms of harm reduction and some of the pieces that you're seeing. And I see Eva is talking about the safe place to stay, who their supports are. So those are the exact kinds of things that we're going to really be starting to hone into. So with that, let's go ahead and start talking about what they need with building resiliency. And I'm going to turn it back over to Veronica.
Thank you, Deb. I'm excited to see those responses in the chat. So resiliency, how is it important in working with this pregnant and parenting teen population? It is key, in my opinion, and lots of others' opinions. It is key. So on the left there, you'll see the kind of the Webster's definition of what resiliency is. And it's just basically the process and outcome of successfully adapting to difficult or challenging life experiences. So if we are working with this population and they're having they've experienced not only an enormous amount of trauma prior to becoming pregnant, those layers of trauma are really going to be kind of put to the forefront throughout the process of experiencing pregnancy and becoming a parent. So we really, as healthcare and mental health professionals, want to help them identify how they have been resilient in the past, in the present, and how they can move forward and use that resiliency to really empower themselves and be comfortable in their skin, be comfortable in their role as a parent, and move forward and be successful in life. In relation to resilience and trauma, that can be defined in several ways. The first one would be positive child outcomes despite exposure to trauma. So we want to help them identify how they've thrived, how they've done well in their youth and adolescence despite the trauma that they've experienced. We also, in relation to resilience and trauma, want to help the prevention of trauma reoccurring despite high risk for further exposure. So being a person of color in the LGBTQ community, they're at high risk for further trauma. Being, maybe an individual who is a part of a lower socioeconomic status can lead to not having housing, not having proper nutrition. There's a large number of things that they can experience that can produce trauma. So in resiliency, we want to help them prevent the further repeating of trauma. And then we also in resilience and with resilience in relation to trauma, we want to help them gain, an avoidance of traumatic experiences altogether in the face of significant risk. So how have they prevented, trauma from reoccurring, and how can they prevent that trauma from reoccurring in the future, even though they still are at significant risk of experiencing that trauma? And just to touch back on what I said a few seconds ago, when we help youth identify and appreciate their resiliency It helps them gain a strong sense of self. They know who they are. They feel confident. They have an increase in their self-esteem. And then they can, encourage their peers with lived experiences to help identify their resiliency. And peer support, mentor support is crucial and critical with the youth population in order for them to thrive. So once, a young pregnant and parenting youth has identified their own resiliency and they feel confident and strong in who they are, they can then help peers who are going through the same thing that they've experienced. So trauma-informed care. I'm pretty sure that everybody who's attending today is, some sort of mental health provider, healthcare provider. And so we're all familiar with using our trauma lens when we're working with anybody, but especially the youth population. If they're pregnant or they're parenting, we have an understanding that they've most likely experienced a high trauma, and so we're putting our trauma lens on, or our trauma glasses, and we're utilizing a trauma-informed care approach. So if we go further down this map, we touch on what the foundations of trauma-informed care are. And those are a commitment to trauma awareness. And so, just working in that trauma lens. And then the second one is understanding the impact of historical trauma and oppression. So, trauma is generational, can be passed down from generation to generation. And when we have, significant historical, traumatic, and oppressive things that have happened to large communities like slavery, genocide, and things like that, the effects of that trauma, they really sink in to the biological makeup of an individual. So we really need to be aware of those things, of historical trauma and oppression when we're working with that trauma lens. And the policies, procedures, and best practices that we can help individuals, youth work through while utilizing trauma-informed care are creating a safe context through physical safety, trustworthiness, transparency, predictability, choice. Boundaries are huge. Helping them restore power, so that ties in with resiliency, helping them understand they have choices, empowerment, helping them identify their strengths, helping them build their skills, and then building self-worth. And they do that through relationships, through respect for themselves, respect for others, compassion, acceptance, non-judgment, collaboration. So this is a really important trauma-informed care, and this model is very important in working with pregnant and parenting teens. Okay, so trauma and healing. This is such a loaded topic, and the healing process and working through trauma is critical, in helping pregnant and parenting teens move forward. And the key to that is helping youth understand their awareness of traumatic experiences, helping them identify what trauma they've gone through and how it has had an impact on their behaviors and on their life. And when an individual has an awareness of their trauma experiences and how it has an impact on them, that is when they gain such a strong sense of resiliency, and they can identify and put into practice useful coping skills that will help them to avoid repeating negative behavior, harmful behavior, and help them to avoid experiencing that trauma again. It's also important that youth understand that collective traumatic events, such as, anything traumatic, really, they can be big historical traumatic events and oppression, or things that just happen within an individual's own family. Those events are stored in the body, and that results in patterns of generational trauma and repeated cycles of abuse. So that awareness that, negative thinking patterns, certain behaviors, that awareness that those events are stored in their body and in their thought process, and then they can be passed down, not only to their children, but within themselves. And then those cycles of abuse and neglect and negativity just repeat. When they have an awareness of that, it helps them to move forward. Also, what's really important is youth being able to identify how they respond when they are triggered. So I'm sure we've all heard of the flight, fight, or freeze mode. And that is often the body's automatic response to trauma triggers. So and we all experience this, when we are scared or nervous, or we're triggered by something that's happened that reminds us of a traumatic event that we've experienced from the past, our body is going to have a response. And we're either going to flight, which is flee the scene, run away, remove ourselves from that situation that is triggering us, we're either going to fight it and we're going to stay there and we're going to try to fight our responses, or we're going to freeze and we're not going to do anything. We're just going to freeze. We're going to be still, and we're going to, our body may get tense, our body may get hot. We're just going to freeze. So once a youth has an understanding of how their body's automatic response to trauma triggers, how their body responds, they can then utilize useful coping skills that they can put into practice so that they don't repeat destructive behaviors. So once they're aware that what their triggers are, how their body is triggered, they can put skills into practice, and so they won't go out there and use a substance. They won't go out there and engage in harmful behavior. So that flight, fight, or freeze model is just really, 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 really critical in the healing process. And then last, there are a lot of useful therapeutic interventions for youth, specifically for a few that are really useful for youth who are part of the LGBTQ community. Voices is a practice that has been very useful within the transgender community. There's also dialectical behavioral therapy, DBT for short, that is useful in helping youth identify negative thinking patterns and helping them identify those patterns, and then how they can reframe those thought patterns so that they are thinking positively. It helps them to identify coping skills, and it helps them really implement positive behavioral changes in their life. So it's really all about thinking patterns and reframing the negative towards the positive, similar to DBT. And then there's also seeking safety, which is a present-based therapeutic modality that allows for participants to help them retain, or even maybe for the first time, feel a sense of safety from their trauma and their substance use. So identifying, the best therapeutic interventions for a youth who have experienced trauma is key. And, there might be a modality, an intervention that's useful for one particular person that may not work for the other. So in doing your assessment and working with this population, a proper assessment will help identify the best therapeutic intervention. All right, with that, I'm going to turn it over to Euna.
All right, so this is the what I call a fun piece, right? So what do we do? What can we do? So when we talk about resiliency, and it was funny, I was talking to Deb the other day, and I was like, gosh, I trained on this like 15 years ago. And I think it is still so relevant, right? When we look at protective factors and what can we actually do? We talked about all these high risk issues and, the risks of the risks and developmentally where they at and meeting them. But then what are our tools? What can we actually do? So when I think about resiliency, I think about, I'm going to go old school, that blue bouncy ball, right? Like your bounce back factor, like how do you bounce back is kind of the resiliency. But then how do you build that resiliency? We look at these protective factors, right? If we look at strengthening these protective factors at the individual level, at the relational level, and also the community level, you want to be able to offset risk. You want to be able to, like the way that I always explain it was, it's like bubble wrap, right? Like you have this, fragile vase. You don't want it to break. It's exquisite, it's beautiful, and you put bubble wrap around it. If you throw it from like a 10-story like building, yeah, it's gonna break. But for the most part, if you are protecting this, right, fragile piece, then the likelihood is that, when things, hit, that there's a better barrier, there's protection around this young person. So it's all about trying to offset risk. It's building their strengths. It's building them on an individual level, relational, the community. What is out there that we can do to help this young person be successful? And in building your protective factors, it's not just the young person, it's actually the child, the baby that also benefits from this as well. So we're just going to go through some of the protective factors and things that we can be doing. So on the individual level, the individual resiliency, cognitive ability, and let me just say that, again, if you have a 15-year-old who is, with substance use and is struggling, you're not going to necessarily go after cognitive ability at that moment. You've got to make sure it's something that you may not want to hit all of them, hit a couple at first, see where their strengths are and kind of go from there. But cognitive ability, it's the math, verbal skills, other measures of academic achievement. So if, if you're able to, but if this is something that they're good at, right, and then you want to build that up, get them into other types of classes or, different things that they can start building up this level, this cognitive ability of them. It also is related to reductions in their school dropout. Of course, they're engaged in school, and for their children, it's decreased rates of aggressive behavior. So huge. What is their sense of optimism? Do they have plans for the future? Do they enjoy life? Where is their level of depression? Do they want to stay in school? So, if you think about, worked with a young man a long time ago. One of my favorites, of course, he loved to boost cars, loved to do it, wasn't very good at it, kept getting caught. So his sister would come in, a couple years older, he was 16 years old, 18-year-old sister would come in. She was in high school, she was going to community college, she was holding down a part-time job. They were raised in the same household by the same mom who had a very significant meth addiction. They were both physically abused, taken out of homes, put into foster care, et cetera, et cetera, et cetera. I have one who had his own meth addiction coming into care. And then I have the sister who has these other goals, but it's because she had other goals. She had a plan for her future. She had the sense that life was going to be okay, that she could overcome this. Whereas the young man I worked with was just like, this is my life. This is historically what's happened with my family if I look at everybody else. And he was caught up in that cycle. So again, that sense of optimism, very, very important. So, and of course, this sense of if the teen mom has a good sense of, optimism, their children are also going to be doing well, right? Cognitively, academically, it's going to translate to them. Does your young person have independence, self-sufficiency, self-care? Are they taking care of themselves? If they're not, how do we start increasing this? How do we start having them, get up and take a shower? I worked with a young gal who, she was 18 years old and had a baby, an infant, and we struggled, right? The depression was postpartum was very strong and wouldn't really struggle with even getting up and taking a shower. So definitely working around that, like those little goals and those plans. But if that mom is taking care of herself, the baby is going to be healthier, right? Healthier infant rates, the more the functioning between the mom and baby, that relational factor, those are going to be there. We continue with the academic skills. Again, the years of education. Are they in high school? Are they going to get their GED? Are they going to be able to graduate? Trade school, community college, whatever it might be. So this boosting academic skills as in promoting positive youth development, it can reduce the birth of, the risk of second births, the stress, depression. It can increase nurturing skills, breastfeeding, and have a higher cognitive competence among their children. So that's significant. Problem solving and relational skills. And I will say that there's not enough of this. There's not enough of this being taught anymore, of really problem solving skills and being able to know how to navigate relationships, right? Conflict in relationships as well. So again, more nurturing parental behavior and reductions in rapid repeat pregnancies if we're able to increase this level, right, of helping a young mom problem solve and develop relational skills. I'm saying sorry. Sometimes that's a practice, right? Like it's not that easy, but being able to have that in the relationship of, in the context of relationships. And then involvement in positive activities. I think a really great place to start too, especially if you're working with a young person who's, struggling with motivation, is getting them involved in some activity, whether it's, in their community or at your center or site, or even, by themselves, or even like starting to read a book or whatever it might be. But it can result in healthier lifestyles, a reduction in repeat pregnancies, and a better socioeconomic status after the children are born. So those are definitely things to be thinking about. How do you build resilience for this young person, looking at their individual, what they can be doing individually? How do you build skills for them? If we look at being culturally responsive, right? So we definitely, I think this is a big area as well to consider with the folks and the youth that you are serving. Are you using the young person's preferred name, their pronouns, right? What is their cultural, what are their norms? Are you exploring what they want to do, right? What is their voice and choice in this? What do they believe is the way for them to get to their best health? We want to avoid assumptions, right? We want to not assume that they will do this or that given whatever their cultural, ethnic orientation is. You want to be sure that you're talking to them about all of this. You want to acknowledge that even though you might have similar backgrounds, share some kind of, culture or race, that your experiences are not all the same. And then pay attention to their culture, their rituals, especially when you're entering into their homes as well. Make sure you are cueing into that. And I think this is a really interesting area for folks for young moms, like again, I worked with girls in residential care, and some of them had their own cultural ways healing of if the child has a cough, the baby, they would soak cabbage leaves and put them on the chest. So that these are those factors where there's you want to respect definitely the ways that their cultural heritage and the things that they know and they've done, but also you have to watch for if the baby actually develops an infection, right? That second level of it. And it's definitely talking through it, because that's the mom or the co-parent or the father. You have to respect whatever that they want to do and what they want to say, but you also want to be aware and presenting that there's other considerations and concerns too. So just being mindful of that as well. All right, and then for the community, how to build community supports. What does the school look like? Are there teen parent programs available? Is there a collaboration with schools? Are there community-based services, right? Sometimes, agencies will come into schools and help with different factors, but you want to look at, are there protective factors such as, long-lasting contraception, right? So we talked about the repeat pregnancies. Is there support for young women with school, job training, employment? You want to look at the what that school environment may look like. Is there a positive community environment? Is there safety in the neighborhood? Is there access to support? Is there services there? Is there like a teen health center or other programs that you can connect them to in the community, right? The resources are making sure that you're building up those resources, and also for the young person to feel like they have that support. Are there economic opportunities? Is there livable incomes in the communities they're from? And huge is, and we'll talk a little bit more about this shortly, is this is you, right? This is where their peers or partners, the adults, staff members, counselors, who do they have? And do they have opportunities to connect with people, outside of their family? Do they have opportunities to connect with peers that are not just all pregnant peers, right? What is the availability for them to be integrated into the larger, to the larger community? For home visitors and counselors and nurses, program staff, you guys are serving as the mentors, as folks who have the information and support. One of the young girls that I worked with, she had she had a baby and she was pregnant with another one. And she ended up during that time period between the first and second to develop a really positive relationship with our maintenance manager. And it was him that she called upon when she had to go to the hospital to deliver her second. It was him that she connected with and wanted there for the birth of her baby. So, right, the people that, were like, oh, that's really cool. And it was great and it was amazing and became definitely a father figure, grandfather figure for them. But that's, the people that you wouldn't necessarily think of pulling into their network is somebody that came in. And that was always a great reminder for me to remember, not just the clinicians or, the nurses or the staff, that there's other folks as well. And then is there social support from their friends, partners, or co-parents? And I'm going to hand this to Veronica next.
Thank you. So in working with recovery and young people and pregnant and parenting teams, we're going to have to think outside of the box. It's 2022 and the world is very different from even when those of us who are in our 30s were teens. Youth nowadays have access to so much information, and there are several various outlets that they can retain information and utilize in their recovery process. So like we've touched on several times today, we want to be flexible to ensure relevance. And like I said, youth, they're growing up in a different world than we are. So what may work for us as adults may be very different for the youth. And we have to keep that in mind. We're going to want to leverage social media support groups and online meetings in the recovery process. Social media is key, I think, and very important for youth these days. TikTok, Instagram, Facebook, I'm sure there's more. And so it's just a great way, social media is just a great way for youth to connect and find supports throughout their recovery and parenting process. We can encourage the use of apps to count sober days. I believe that AA and NA have apps where you can count your days of sobriety, and there are just various very useful applications out there that youth can just download on their phone, and they can receive resources in their recovery process. And along with that, there are also a plethora of phone apps to reinforce new coping skills. There are apps that you can download and that will send you reminders to take deep breaths or to drink a certain amount of water. Or on my phone, I have an affirmation app. So every, I think, 3 hours, it sends me an affirmation, and I got to choose, what kinds of affirmations I want. And it sends me like a notification on my phone. I am strong. I am this. I am that. So there's so many resources out there on social media and online that we want to encourage this population to use in their recovery process to move forward. We also want to leverage telehealth. So since March of, 2020, feels like so long ago, telehealth has become a huge force in the healthcare community. I know for myself, telehealth has been very, very useful. In mental health services and just my primary healthcare services, and for youth who may have issues with transportation or may have issues, getting somebody to watch their children, It's just very accessible. It's very convenient. And like I said, they're growing up in the age of technology and social media. So for them, it's a natural way of engaging in communication and conversation. So it's, if we're going to be working with this population, it's very important that we are utilizing telehealth. It just helps to increase positive outcomes and ensure that youth are engaging in treatment services, because it's what they know. So we want to use it. And then outreach, prevention, and educational information can be shared via patient portals and social media apps. And one of the useful things about social media apps is that you can share the information. You can share it to your story, to your feed, or you can post and repost, and so friends can see it. Friends can see the positive changes that you're making. They can show off the positive changes they're making in their lives, to encourage youth who are maybe in a similar situation. They can just share, repost things, and that person can share and repost, and it can go everywhere. So social media can be a great tool, not only for youth to share what they're experiencing, but also for providers to share educational information, provide information about the services that they provide. And it can also, there's so much out there in social media, and for if you don't know how to navigate it, once you learn it, it's pretty easy. And it's just very, very useful in working with this population. And then the last one is text messaging appointments and medication reminders, help with the continuity of care for this population who, they're still learning to implement those life skills of going to pick up their medication, attending medical and mental health appointments. They're still, learning the importance of medical care. And they're still learning to implement those life skills in their life of scheduling appointments, attending appointments, using a calendar to remind them about appointments. And so text messaging reminders, medication reminders can be really, really, really useful for this population. And also because we know that when youth have experienced significant trauma, that can result in cognitive delays in their brain. And so they're not able to process information and remember information as well as youth who have not experienced the trauma that they've had. Okay, with that, I'll turn it back over to Euna.
All right. Thank you, Veronica. So we want to talk about how do we foster family connections. So we want to, when safe and available, living with the family member can help reduce repeat pregnancies, increase self-esteem, educational achievements, and lower rates of depression. But I want to key into when safe and available. So making sure, and I think somewhere in the chat, how do you know this, right? What does safe and available mean? We know that it helps. This is kind of the end goal for these young pregnant and parenting adolescents, but making sure it's safe and available. We want to help the young person consider who they have as positive connections within their family and also other personal supports, and how they define family, right? It doesn't necessarily need to be biological. Who is family for them? Who is support? You want to definitely, and as we kind of going back to the family member, you want to help them strengthen the relationship, right, between the teen parent and the child, and the teen parent and their own parents whenever possible. It's that dual kind of role that you have, because the outcomes are going to be better for the child and for the young mom. You want to explore who else is helping to co-parent them, and then also to help learn about that nature of that relationship. So definitely a lot of things to do there. And helping the young person develop parenting skills, right? The quality of that mother and child relationship how does a young mom know how to properly feed and care for her infant? There's definitely a lot of work to do. Has this young mom ever been around a child before? It could be that they are, the oldest of 10 siblings and they have been doing this and they can change a diaper in their sleep. Or it could be that they've never even changed a diaper, held a baby, had any interest in children, or been around, infants and children. So it's assessing out that level of skill and what this young person thinks. I remember going to my, parenting class when I was pregnant. And, first question I asked was, how do you know when it's like dangerous? Like when you have to go to, bring them into the ER and emergency room, and all the hands started going up, and we're all, older parents, and they're saying, yeah, how do we know? And it's not that simple. The nurses are like, it's not that simple. It's not like necessarily a 1 + 1 = 2 equation. So it's all of that, right? And the thinking skill, and you're also dealing with teenagers, right? So may not cognitively be as aware. So making sure you are assessing out that and helping them understand what that quality relationship looks like, what it's supposed to be. You also want to be aware of if that young person, this young mom, experienced trauma, childhood abuse of her own. So let's say she was 5 years old and she was, abused by her mom. Knowing that, right, that could be a trigger for her. Knowing that at that point she could shut down. Knowing that this could, again, generation cycle continue, and she will choose, to rehash her childhood versus using a different way. So being aware of all those things and making sure that you're learning about this young person. You want to make sure that you are helping this young person understand their child's emotional development. What is attunement? What is co-regulation? How do you foster that? You want to make sure that this young person has support from her own parents. And that also impacts how she's parenting, right? So kind of historically, what this young person can talk about, how she was parented, what she remembers, how those things are going to influence her. Because working in a group home with 6 teenage girls, the things that would pop out of my mouth were my mother, right? I was just like floored by that. I was like, oh my God, I can't believe I just said that. But the things that would come out, because that's how I was parented. So that stuff is repeating. So just being aware of that. There's definitely curricula for children and parents, especially with families and substance abuse, celebrating families models, strengthening families program, nurturing parenting program. But just remembering that no matter what the curriculum is out there, you got to make sure it's developmentally appropriate, right, for this young person. And we're talking about teens. It could be 13-year-olds to 21-year-olds, making sure it's developmentally appropriate for them. And then also their children. You may be dealing with just infants or infants plus, 2, school age and a toddler. So just making sure that whatever it is, that it's not just a one size fits all, that you are tailoring things to the developmental level, and also what the needs are for both your young parent and child. And we want to talk a little bit about positive co-parenting. So positive co-parenting, it's that shared responsibility. It's working together with somebody to ensure the positive development of the child. And this doesn't always is the father or the baby's dad, or the partner. It could be a grandparent, it could be a family member, it could be a friend. In residential care, this could also be program staff. It could be you that's helping co-parent. So the benefits of it, especially if there is a father or co-parent, is that there's increased involvement, right? Especially from someone who's not living in the home with you. So making sure that if you have somebody else there, that this young person also has more support. The positive and supportive relationship between the teen mom and her mother, and the teen mom and the infant's father, has been a protective factor for both the teen mom and the child. So again, making sure that we're trying to foster that, for their own families, and then for whoever the co-parent or father may be. You'll also see that one of the benefits is there's decreased child externalizing behaviors like the aggression and the hyperactivity, and better social skills for the child if there is positive co-parenting being seen. We also want to promote positive co-parenting by teaching skills to help co-parents, right? You want to support each other's parenting efforts. want to share decisions regarding the well-being of the child and communicate and delegate responsibilities. So I think this is huge, the encouraging and support. You want to encourage and support the mom in establishing the clear set of boundaries for co-partners and other family members. Veronica, did you want to, I know this was kind of a piece for you, so I wanted to.
I can touch on this, sure. I think we want to encourage youth who are becoming parents and, learning to, to grow in this role of being a parent, to learn how to set boundaries with the individuals who are in their lives. I was a younger parent, and so I had a lot of help, and it was, it helped me tremendously. But throughout those first couple of years, I really had to establish with my support system that I was the parent, and I had the final say so in medical issues and anything regarding my child. I think that when we're around a young person who's a parent and then be struggling, we're gonna, individuals may show a lot of care and concern and really want to help because it comes from a loving, caring place. But at the end of the day, that teenager is the parent, and they need to learn how to be a parent, and they need to stand strong in their role. So we need to respect the boundaries that they put in place with their children. It's hard for all of us to set boundaries with, well, I can't say all of us, but it might be hard for all of us to set boundaries with any individuals in our lives, especially, with a youth who is still under the care of a facility or their grandparents or their parents. That kind of role reversal of them being in charge can be really challenging for them to establish their boundaries. But it's really important because as parents, we know we really have those instincts. We know what's best for a child. So
right. Thank you. Super helpful. And again, kind of going back to it being consistent, providing that safe space for co-parents to engage together and separately, and always screen. So I'm going to turn it over to Deb now.
Great. Thank you so much to both of you. You've covered a lot of territory related to some of the things that we want to be paying attention to and doing when we're working with pregnant and parenting teens who've been misusing substances, and there's just so much kind of content to cover within this scope. So, just to kind of think about the different elements that we've heard about a little bit is using the trauma-informed approach and making sure that it's customized and that you are paying attention to being trauma-informed and providing trauma-specific services for that youth parent, but also sometimes their kids have experienced trauma as well, and making sure that any trauma services that you're providing for their children are also developmentally appropriate and paying attention to them as a unit as well. So you're supporting them as individuals and you're supporting them together. Then we have also, strengthening those protective factors and building those recovery supports in ways that youth are familiar with, So, Veronica talked a little bit about texting, and, we know that if you want to get a message to a young person, texting is going to be much more likely to get to them than using a phone call automation for a reminder or an email for a reminder. That's just not the way to kind of get that information available and accessible to them. Building things in ways which are flexible and are developmentally appropriate, right? Because they're they may be learning about being a parent. They're learning about entering into recovery. Somebody earlier talked also about harm reduction. It might not be like a recovery that's like a full abstinence, but also, who do I want to be in this world? How do I want to relate to who I am culturally, what I might want to do for my purpose, my community, and building those things so that the young person doesn't end up kind of isolated and feeling like the world is moving forward kind of without them. Promoting the positive youth development, culturally responsive, building those community supports because, they really can't do it alone. The foster family connections, include and how we kind of move forward with some of the co-parenting. And so we've worked kind of to show you all of these different pieces. And we know that many of you are already working with pregnant and parenting adults. And I wanted to just kind of close with sharing this as a comprehensive model. This is the Your California Service model that Veronica has done some work with, and Euna is the program manager for, is so that you see how the kind of dots all connect. Now, what this does not have on it is those same models where we're paying attention to both the parent and the teen, and their children. So what kinds of services are we also providing for them in terms of their children? But if you take a look at it over the overarching pieces across the top and the bottom, if we want to be reaching and serving youth, we have to be culturally competent, age appropriate, trauma informed, grounded in harm reduction and positive youth development. So looking at the kinds of services that you're offering and how they fit within all of those frameworks, much of which has already been thinking about in terms of the entry points where youth come from, how are they getting to you? Are you doing some things so that there is some screening and engagement services happening at some different places, so that if it's a program for pregnant teens, is there some screening and engagement happening around substance use, and then engaging them in different kinds of strategies, whether it's SBIRT or more comprehensive services. If you have a teen adolescent SUD program, the same thing in terms of what kinds of education and access and engagement are you doing around pregnancy, and how are youth coming to you? And then we have kind of, I'm going to do the green side, the ongoing support, because you may have concrete treatment, but then afterwards, this is like a lifelong process, right? They're going to be engaging in parenting, engaging in recovery, and learning for quite a long time. So how are you going to continuously support people? And, you know, as if you go back to some of the earlier statistics, we talked a little bit about after the baby is born, during that postpartum is a very vulnerable period. So paying attention to what's often called that fourth trimester. And then we have the kinds of interventions that these youth are often going to need. And again, we may be doing screening, engagement, navigation for that young person, but then also helping them do those same kinds of things for their infant and children. And then using the evidence-based practices, the coordinated care and communications, and then providing those array of services that we've really already talked about in terms of the evidence-based, use-specific counseling, access for medications for addiction treatment, which depending on where you are legally, which medications are available, but it is still, if you have a young person who is using opioids, medications is usually going to be the indicated practice while they're pregnant, and often beyond. Recovery supports, family engagement, family services with that whole model, and of course, everything embedded with case management and assessment and treatment planning. So thinking about all of those different pieces, really using that lens of what is it that our young people need, kind of as we're closing, to build those protective factors and that life of recovery as people move forward. So I'm just going to go over a couple of quick things as we're closing. As I mentioned, this is the last of our 3-part webinars. I want to say a huge thank you to Euna and Veronica, and also Beth, Beth has been the producer for all of these, for all of the great information that you've provided. And we do have a summer PPW leadership learning collaborative that's kind of the next step with Jean and the Great Lakes ATTC. It will be meeting every other Tuesday from August 2nd to September 27th. You will get this with the link to join the waiting list, although the learning collaborative is actually full. And you can see also on the slide the topics. If you are interested, I would go ahead and join the waiting list for this. You also will be receiving 2 evaluations. Is this the one where we're doing the second evaluation, Jean?
Yes.
Yes. So you are eligible for continuing education as a result of this, and we actually have a two-prong evaluation process. So you're going to have a link for an evaluation that you complete to get your certificate. We also have a second evaluation that is really important for the Great Lakes ATTC for the overall series. And that will be, is that coming into the text box as well, or are we sending that out to everybody?
We are going to be sending that out.
Yep.
Okay, great. And we really do ask you all to participate in responding with that one as well. And I think so. We have the evaluation. I think that those are the main pieces. Let me see, Jean, is there anything else that you want to add regards to the learning collaborative and or the evaluation process?
Just that, yes, fill out the evaluation that's in the chat right now. And then once we send out the recording and the slides, we will send out the separate evaluation that we would like people to do. It's super short. It won't take long. And thank you very much to Deb, AHP, Euna, Veronica, and the whole production team staff.
Great, great. Thank you. And I will just leave you with one of my favorite closing quotes. It's a Don Cohus quote. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. And encourage you all to continue to do the great work with young people, pregnant and parenting teens, and young adults that you're seeing, and with everything, and go forth and do great work taking care of your flowers and your bouquets. Have a great day.